Dr Philippa, Whitford.
Thank you very much, Madam Deputy Speaker. Having spent 33 years as a surgeon at the very sharp end of the NHS, I welcome the multi-year funding because it should allow better planning. But it does come after a decade of drought. Between 2010 and 2015, the average annual uplift was 1.1%. Between 2015 and 2018, it was only 2%. And that means over that period of 8 years, the NHS in England faced a real terms cut. That was during a time of inflation and particularly rising demand with an ageing population. And that's why quoting the spend per head is actually more realistic and more accurate. Now, Scotland spends £136 a head more on health. And this is why the Secretary of State is forever claiming that Barnett consequentials are not passed on in Scotland. Every penny of resource consequentials are passed on. But a little explanation of percentages. If your starting amount is bigger, the same amount will be a smaller percentage. Now, we've explained this before, but we keep having this nonsense. And in actual fact, if the Scottish Government used the same per capita spend on health as the UK does for England, we'd be £740 million worse off in Scotland. I will give way.
I thank the honourable friend for giving way, and I raised with the Minister the concern about the cap that they've put on the spending figures by use of the money resolution. But this whole bill is going to be committed to the English Legislative Grand Committee, so members from Scotland are not going to be able to table amendments to pursue exactly these kind of points with the government, to inquire, as other members from the rest of the UK will be able to do, to table probing amendments to question the impact of their government spending. Does she not agree that that really undermines the point of this being a sovereign UK Parliament?
Well, obviously, the whole issue of English votes for English laws applying to bills that have direct Barnett consequentials for the three devolved governments is complete nonsense, and certainly makes all the devolved MPs second class. Now, the government is committed to £33.9 billion by 2024 in cash terms. As has already been pointed out, this is actually just the same £20 billion that was promised in 2018. It's not extra new money. It's not on top of that. It's the same amount. It's been described as 3.4% in real terms, but the Health Foundation has already suggested that due to inflation, this actually means only 3.3%, while the Institute of Fiscal Studies actually predict it will only be 3.1%. And this is the key problem of making a commitment in cash terms. If inflation rises post-Brexit, and I mean at the end of 2020, as is likely, the commitment would simply wither on the vine. It should be front-loaded as the urgent need is now, and it should be in real terms. Otherwise, talking about 2024 in cash terms is actually just pie in the sky. The three main health think tanks and the BMA think that actually 4% is required to restore the service to the performance that is expected. More than that would be required for service redesign to match the shopping list that we heard the Secretary of State recite. Now, I'm glad he's moved away from talking about apps. The idea that you're going to rub a mobile phone over your tummy and it will diagnose appendicitis is for the birds. People need doctors. Healthcare is delivered by people. And the idea that an app on your phone replaces it is just nonsense. But I was glad to hear him talking about internal IT within the NHS in England, because frankly, after the Care.data scandal, it has fallen behind. There's a lot that could be done IT-wise to utilise the workforce that already exists in a much better way. In Scotland, through the PAC system, radiologists can view any X-ray anywhere in Scotland. We have electronic prescribing, which isn't only efficient, it's a patient safety issue, because you cannot prescribe a drug to which the patient is allergic. And these are things that should be focused on, rather than gimmicky apps on your mobile phone. This is again just money focused on the NHS revenue funding. Now, the long-term NHS plan was predicated, exactly as the 2015 five-year forward plan, we're seeing a bit of a theme going on here, on game-changing investment in both public health and social care. The public health grant that's currently proposed to local authorities is only expected to rise by 1%. That means a real terms cut, a significant real terms cut, on the back of £850 million of cuts that have already happened and seen a reduction in smoking cessation, sexual health and addiction services. That doesn't make sense, as even the Secretary of State admits prevention is better than cure.
She's making a very good point on cutting away at prevention services. One of the services in England which has seen huge cuts is in breastfeeding support services. If those are properly invested in, they can be a huge investment for the future of health as well as the here and now.
Well, I welcome my honourable friend's intervention, and obviously this is a topic she does a lot of work on. There is no question that a lot of investment must go into the earliest years that children experience, because in actual fact your risk of so many conditions in later life is actually laid down between conception and the age of 2, and therefore energy and funding should be focused at that point. Now, we've been waiting for 3 years for the promised Green Paper on social care, and there was absolutely nada in the Queen's speech. But that's a discussion about how to fund social care, how to come up with an innovative system of raising the funds. It's not an argument about whether social care needs to be funded. The answer is quite simple, it does. And the gap is currently over £6 billion. Now, in Scotland, as well as spending more on health, we spend £130 a head more on social care. But that allows us to provide free personal care, which allows people to stay in their own homes and live in later life with dignity, where they want to, where we would all want to be, if we needed support. Now, this was extended last April to those under the age of 65 who need it, who also have degenerative conditions such as Alzheimer's, MS or motor neuron disease. And I think this would be a worthwhile investment for the UK Government to consider, because you simply can't fix the NHS without fixing social care. Now, the Prime Minister enjoys trumpeting his 40 new hospitals when we know that it's actually 6. But there's no mention of additional capital funding to cover the over £6 billion of backlog in maintenance and repairs that the shadow frontbench described so visually. One could almost smell some of the problems that he was describing. Now, this built up when NHS trusts slid into £2.5 billion of debt after the introduction of the Health and Social Care Act, because the transactional costs, the bidding, the contracting, was taking so much money away from the front line. And what we saw year after year was this repeated movement from capital to resource, just to keep services afloat. And that's something that has to be stopped. Now, the biggest challenge in all 4 health services is workforce shortages. And that's already being made worse both by Brexit, with a 90% drop in European nurses and indeed European dentists coming to this country, and also the issues around the pension tax reforms that are driving senior clinicians, particularly doctors, to be cutting their hours and their shifts. This is making it an acute issue. In their manifesto, the Government committed to 50,000 extra nurses, and we saw the Secretary of State leaping up and down in delight, boasting about it. We are to expect these extra nurses over the next 5 years. But the problem is we're still waiting for the 5,000 extra GPs that were promised for the last 5 years. Yep. And there's actually 1,000 fewer GPs in England. Now, everyone should welcome expansion of the nursing workforce from 280,000 to 330,000, whether it's done by recruitment or training or whether it is due to retention. I don't have an issue with that. But it was costed in the manifesto at £870 million. Now, I'm sure everyone welcomes the return of the nursing bursary, even if it's only half of that we provide in Scotland. Unlike in Scotland, nursing students will still have to pay tuition fees, and this is likely to deter some mature students who have a tendency to specialise in mental health and learning difficulties, areas of huge nursing shortage. What's not clear is what the £879 million is actually for. Surely it can't be for their salaries, because that would only be £17,500 a year, which isn't even real living wage. So if it is actually for training and the bursary, have the government forgotten to add their salaries into this bill? Because 50,000 extra nurses is a significant hike in the NHS salary bill. I have to say, if it's the former and they're planning to recruit at £17,500 a year, good luck with recruiting anybody. This government simply needs to reverse the real terms cuts they have made over the last decade. But on a point of principle, they need to go back to discussing funding of the Department of Health and Social Care in the round, not picking out the NHS in England to make it sound like a big number, but actually cutting everything else. It is critical to invest in prevention and to invest in social care. So a return to departmental spending and departmental investment would be very welcome. And in all of this, they need to make sure they are wrapping services around the patient. The patient is the person who should be at the centre of NHS and social care.